these dark times will pass. I personally saw in my practice in RN last week that I've known since 1993. She is a warrior, and I would work by her side any day. She came into the office last week in tears, not sleeping. She had taken care of COVID ICU patients that were not doing well. She cared for 2 of the 3 that passed away at our hospital last weekend. She had flashbacks of patients suffocating. With the help of employee assistance, we got her in to see the counselor that afternoon. Many healthcare workers need help now, and we need the public support. What I can say is, though, that we have less COVID patients today than yesterday. We are still waiting the effects of the Labor Day holiday and, of course, the 2 OSU home football games. Overall, our patients are younger and sicker than the last surge. The length of stays are longer, up to past 20 days, and some have been on the ventilators for over 10 days. When I asked our hospitalists what I really wanted, what they wanted me to say, and it was really that last week at one point, we had 22 ICU patients in our hospital, and we only have a 7-bed ICU unit. We are still under the crisis standard of care. And, over the last few months, we have lost approximately a third of our ICU nurses. So we're working with less staff and having more patients. The ratio of the caregivers to patients still is concerned, which limits the number of staff beds that we have available. I can tell you many of our staff taking care of our patients now are not the same staff that cared for our patients in the last surge. Staff turnover has been high. I want to let you know that our staff is physically exhausted, emotionally spent, and psychologically impacted. The strain on them has never really been greater. With our ICUs being maxed out, our non-emergent surgeries have been canceled, patients needing med-surg or intensive care units being held in the emergency room, our staff hospital beds are just full, and this has been going on for weeks. To quote our own Dr. George Monks, it's okay to not be okay, and you need to seek help if need.